Hi, it's nice to be with you all tonight. My name is Dr. Tanya Cardash, and I'm myself made Aliyah from England 14 years ago. Hope you'll all excuse the British accent. I think most of the people here are American, but you'll have to put up with it for a little while. And I've been working in Maccabi since I arrived, and for the past 6-7 years, I've been acting in an unofficial capacity as the liaison to help Oleh navigate the healthcare system. It was something that my family went through and I found very daunting. So the minute that I was in a capacity to be able to help other Oleh, it was a private mission that I took on myself, a personal mission to help all of you. I'm going to give you a lecture which is something that over the years I've added to, taken away to give you a basic structure, and I promise I won't go home until I've answered all of your questions, even if we're here till 11 o'clock at night. So just scribble it down on a piece of paper and I'll ask them at the end. Okay, we're going to go straight into it. I'd like to just give you a very basic background. The National Health Insurance Law in Israel was made in 1995. It was a very, very important law, and it puts the Israeli medical system in a very, very good position, especially when comparing it with countries that have mainly private insurance systems. It offers universal coverage. Everyone who is a citizen of Israel is entitled to coverage. It doesn't matter if they're working, it doesn't matter if they've got no money, it doesn't matter if they don't have an address and they're living on the street. Every Israeli resident with a Taudat Zehut is entitled to healthcare coverage. There is a basket of healthcare services which is called the Sal, the basket, which the government says the health funds have to offer. So there's not really any big decisions. People are asking me the whole time, which health fund should I go with because I take this medication? The government defines which medications have to be offered. Again, it's very different to what I've seen in other places such as America or even England, where there can be differences according to your postal address. It could be in one area. There was a big scandal with the medication Herceptin, which you might have heard of, which was used for breast cancer in its early days. If you lived in a certain postal district, you would be approved it by your health authority, and if you lived somewhere else abroad, you wouldn't. That doesn't happen in Israel. The government says these medications, these operations, these services are going to be in the health basket. In a few minutes I'll tell you what they are, but you don't need to worry that you're going to miss out on your medication because you joined the wrong health fund. There's again a freedom of choice of health funds. If you've joined a health fund and then you find you've moved to a new area, or just the doctor there isn't suitable, or you want to be with another health fund, you have a right, like any other Israeli citizen, to move to another health fund. There are 6 periods in the year, there are 6 dates in the year where you can move health funds. You're not allowed to change more than twice a year. But you're allowed to go to the post office or go online to the internet and fill in an application to move health funds, and it's as easy as that. Now, how do you pay for the healthcare in this country? The way that you generally pay for it is that if you're a salaried worker, as I am myself, there is a national insurance contribution that we all make to Israel, which is deducted at source on our paycheck. Out of that national insurance contribution that one pays, there is a certain amount which is earmarked for health coverage. If someone makes Aliyah, and let's say they're a retiree, they're pensioners, they're not working, you probably are familiar with the fact that you get Bituach Leumi slips, not within the first 6 months or year of making Aliyah, but afterwards you get a little slip which looks like a check, which you make a contribution to your national insurance coverage, and again the healthcare contribution that you pay comes out of that. In addition to that coverage, there is a small co-payments that you make. You've probably seen on your bills from your health fund, whether it be for medications, whether it be for doctor's visits, and it varies slightly according to your age and which services you've used, but again the out-of-pocket expense here is generally quite low when you compare it to what out-of-pocket expenses are in other Western countries. All the money then comes into the pot of the National Insurance Institute. The money is then redistributed to the health funds according to per capita calculation, which means the number of heads that are in each health fund. So if, for example, Clalit has 25% of the population insured with them, they get 25% of the pot of money there. There is some adjustment, which I won't go into, according to the age profile of the population. So if you've got older population and sicker people, you get a slightly higher amount of the money in the pot. But generally, that's how it's based. So I've given you a little bit of history. I've talked to you and I've told you basically about how the SAL gets its money and how it's given out to the healthcare system, how it's given out to the healthcare providers. I don't know when you came, but probably you've been here 6 months, a lot of you. The first period of time is free. You're exempt from paying membership or bituach laumi. And after that, according to your status, it's either prolonged for a year or it finishes at 6 months. There are 4 healthcare funds. Again, when I'm addressing the question, how does one decide what to join? There's a number of things you have to think of. I'll say it again because it's very important. Generally, the service that you're looking for will not be particular to only one health fund. If you're looking for a medication being approved or a certain surgery, that should be in all 4 health funds because it's dictated by law. I'll come to the exceptions afterwards. So thereby, you choose your health fund by maybe the area you're going to live. You might be moving into a yeshuv or somewhere where there's only a Maccabi and a Clalit clinic. So then you'll join one of them. It might be that you've heard about a specific doctor who speaks English on a mother tongue level and you want to be with them. Again, you'll decide to go with that health fund. I very much recommend people, like any other subject you're researching when you're making Aliyah, speak to people who made Aliyah a few years before you. Speak to people who are living in the area. Say, listen, which health fund are you with? Are you happy? Are you with a doctor you can communicate with? We always say it's very important when you've made Aliyah to find someone to speak to you in your mother tongue in 3 major fields. One of them is an accountant, the other one is a doctor, and the other one is a lawyer. So again, it's very important to speak to these people in your mother tongue, because to start to break your teeth and speaking to people about hemorrhoids when you don't really know the vocabulary can become very embarrassing and you can find yourself in a very difficult situation. Again, choosing the doctor is something that in 2 of the health funds, in Maccabi and Mu'chedet, you can choose your doctor, okay? You can come to the town, they can say, the other colleagues of yours or friends who are Olim can say, you know what, we've got this great doctor in Ramat Bet Shemesh, he speaks English, it's worth going to him. You can get in your car and you can drive there, even if he's 10 minutes away, 15 minutes away, whatever your choice is. With Klalit and Laumit, you are allocated a doctor according to your residential address. So if you live on Rehov Shimon, and at the end of Rehov Shimon there is a clinic of Klalit or Laumit, you're automatically allocated to them. You can appeal afterwards to move to another doctor, but in the other 2 health funds, in Maccabi and Mu'chedet, you're much freer. You can open the book, you can say, you know what, my friends recommended me in this doctor, I'm going to make an appointment with them. Changing doctor is generally something that you're free to do. You can change at the end of the quarter. The end of the Rivom, which is a 3-month period of time, you're entitled to move to another doctor if you're not happy with the services you've received. Within the quarter, if you have any feeling that, you know what, I didn't have the chemistry with this doctor, I don't want to go back to him, you just turn to someone in your local branch, you say, listen, the chemistry wasn't there, I would like to request to change to another doctor, and they'll give you approval. The reason that they do give you the barrier of changing once a quarter, or if you want to change within a quarter, turning to the office, is that we do believe here in Israel that your primary care doctor is someone who coordinates your health care. So we don't really want a situation that on Sunday you go to one doctor, Tuesday another, Thursday another. It might be fine for a younger, healthy person who's only going for acute illnesses such as tonsillitis or a viral infection, but for a different population who might have chronic conditions which need follow-up, it's much better if there's a continuity of care. Now, of course, none of this applies if your doctor's on holiday. If your doctor's on holiday, there's always a doctor backing him up, or you can make an appointment with another doctor. It won't be that because your doctor's not there, is ill or is on leave, that you won't have someone to service you. Okay, the healthcare basket. Generally, the things that are in the healthcare basket are doctor's visits, blood tests, imaging studies, including ultrasound, X-ray, CT, MRI. Questions that are very often asked. in emails that I get, will I be able to have 1 MRI a year? Will I be able to have 2 MRIs a year? The answer is, in Israel, it's very naki, it's very fair, it's very clean. If your doctor thinks you need an MRI on a monthly basis and there is medical justification for doing so, you will be allowed an MRI every month. There's no limit, there's no capping. Okay, no, you've had enough, we've spent too much money on you, you're not allowed it. The same with things, for example, such as physiotherapy treatments. If a doctor thinks that you need 2 physiotherapy sessions a week, then you'll get them. If you want them and no doctor feels you'll need them, you might only be allocated a smaller number of treatments. But it's a needs-based system, not a limit that you've reached your ceiling, you're not getting any more. Hospital admissions and surgeries are covered. Paramedical treatments such as physiotherapy, occupational therapy, speech therapy. Child development treatments are slightly different. I'll come to them and I'll explain that category afterwards. Medication. There's generally a 15% co-payment for medication, which I have a lot of patients myself who come from America, and they generally say to me that they find that their medications here are generally much cheaper than they were in America, even with the 15% co-payment. On top of that 15% co-payment is another level that's put in to help our patients, and that is a ceiling of 250 shekel a month for the medications that you take in the healthcare basket. So, for example, if I have a patient, and it happens very often, who's got diabetes and a bit of blood pressure and a bit of cholesterol, the minute their bill hits 250, they won't pay any more. Even if it carries on clocking up to 400 shekel, you don't pay any more after 250. The issue of the co-payment stops. So the maximum co-payment anyone making Aliyah will have to pay for medications in the healthcare basket, and I would have thought 95% of the medications that all of you sitting in this room take that are actually in the healthcare basket, it has a maximum ceiling that you don't go over. We have other special characteristics which Shalom Nidar, and we won't go into. Again, cancer patients, people with certain life-threatening diseases, don't pay anything at all. Also, categories of people who can't afford to pay, who have a code in Misad Revacha, in the welfare system, we also give them exemptions to a certain extent of payments. But they're things which Miriam can help you with if and when the time comes, and please God, it would never come. In the past few years, dental care and treatments for children until the age of 10 has been put in the healthcare basket. That's something historically that wasn't in the healthcare basket. But it was decided here, because of the poor dental hygiene and because of the number of children who weren't getting the adequate primary dental treatment as children, they decided to put it in as something which was without payment and with free access to everyone. I must tell you, it is a huge financial drain on the healthcare systems, and this is one of the major reasons that all of the healthcare systems, you might be reading about it in the newspapers, all of the healthcare systems are finding themselves in deficit at the moment, because the government has no more money to compensate them. And if you think in Israel, thank God we're a population where we have a very, very high birth rate, to all of a sudden take all of the population under 10 years old and say you are all entitled to free dental care. It doesn't matter whether it's fillings, root canal, anything, is a huge financial burden on the system, and the health funds haven't received compensation. But we're not going to go into that now. We're all in the same boat, all of the healthcare funds, and that's something you don't need to worry about at the moment. Optometry is also something which isn't in the healthcare basket. I'm not talking about the right to see an eye doctor and if someone needs a cataract operation or someone who has a medical problem in their eye, but I am saying, for example, if I want to go and buy myself some contact lenses or glasses in the optometrist. When we get to the section on supplementary insurance, I'll explain to you, all of the healthcare funds have a way of subsidizing that cost in the extra packages that they give, but it's not in the healthcare basket. Now, another field which is in flux at the moment is psychiatry. Previously, psychiatry and psychotherapy was something which weren't in the healthcare basket, but we're now in a state of reform. And gradually from now already, from 2013 to 2015, these services are being discharged more and more to the community. Now, what that means is basically the government has seen that there's two reasons basically for doing it. First of all, the government has seen how successfully the health funds manage to coordinate the care they give to the individual patient, and also it's a process whereby they want to destigmatize the mental health field in Israel. So it's another one of the conditions that people can go to see a doctor in the community. It's going to make very little difference other than the fact that physically the same psychiatrists who might have seen people in an external Tachana, Briut Nefesh will now sit within the Maccabi buildings or within the Klalit buildings, and you'd go and see them there as you would go and see a vascular surgeon or a cardiologist or an endocrinologist. I think it's a very wise move. I think it will improve the communication between the healthcare professions. So at the moment, that's something which is in flux, but it will be in the healthcare basket very soon. Chronic nursing care is also something which is provided by the state and not in the healthcare system. I'm not talking about giving money or giving aid to help at home. I'm talking about the situation where someone needs to be admitted to a nursing home, not an old age home, but a nursing home because they are unable to function anymore at home, which generally means someone who can't perform the activities of daily living. Normally talk about if 3 out of 5 of the activities of daily living can't be carried out by the patient, which are washing, dressing, feeding, toileting, and transfers from bed to chair. That already puts someone in a category of nursing care, and that's something which the state pays for rather than the health funds, but you would also be entitled to that, so it's not something you need to worry about. Now, I'm going to spend a few minutes speaking about primary care medicine, because primary care medicine is really the key here. This is the primary care doctor that you choose for yourself is someone who is going to help you navigate the healthcare system. First of all, over the years in primary care medicine, we've become less and less reactive to the situations that patients present us. We don't see, myself, I'm a family doctor, we don't see our job now just as treating someone who's come with a pneumonia or someone coming with a throat infection. We see our job to be proactive. A patient who comes and sits with me, I'll check his blood pressure, I'll check when his last cholesterol was done, I'll check if a lady's done a mammogram, I'll check if someone needs screening for colon cancer, because where we can really make the difference is trying to prevent illnesses and diseases which can affect morbidity and mortality in the future. Now again, I spoke a little bit to you before about how to choose a primary care doctor, and it depends on the health funds. Very important you find someone who's suitable for you, and feel free to change between doctors until you find someone where you get that click with them. Now, another reason that your primary care doctor helps you navigate the system and acts as your care coordinator is over the years, specialties have become much more subspecialized. For example, in the past, if there was such a thing as an orthopod, an orthopedic doctor in the community, and he saw everyone, now we know that there's an orthopod who specializes in knees, there's someone else who might specialize in arm and shoulder, there's someone else who might be more of an expert in backs. Now, your doctor will know who works in the area and who is suitable as a caregiver for these things. So even though you can actually turn to an orthopedic doctor without a referral from your primary doctor, it's always worth going via him and saying, who do you recommend I see? Or this is my problem. Very often also, someone might complain to me they've got hearing loss. Now, it could very well be that I'm not an ear, nose and throat doctor, but I can check to see if the person's got wax, and I can send them to do a hearing test. So by the time they actually come to the ear, nose and throat doctor, they've got all of the information for the ear, nose and throat doctor to be able to make a treatment decision and not just send them away and say, well, first go and do a hearing test and then come back and see me in another 2-3 weeks. Again, we provide referrals to support services, including social workers, physiotherapists, and of course the Homecare Team, if someone gets to a state where they can't carry on being cared for at home by themselves without input and support. If we come to the field of pediatrics, the same is true. The primary care doctor for the child is generally a pediatrician. Family physicians in lots of areas also see children. It depends on their exact qualification. A family doctor such as myself is allowed to see children and adults, like you have in England, where it's from cradle to grave treatments. But someone who's a primary care specialist in Israel, a Refer Pnimai, can only see adults. I started to explain to you before, in some fields there is direct access to some specialties. For example, orthopedics and ENT, which I spoke to you about. In those professions, when a patient would like to see them, I would recommend going via the primary care doctor, even though you don't have to. You can just phone up and make an appointment, and I'll show you the ways to make an appointment without going via your family care doctor. But I think your primary care doctor will help you find the right address. Other specialties which also it's logical that you don't need any approval or paperwork from anyone is obstetrics and gynecology. For your annual checkup, if you've got a problem in that region, you can just make an appointment straight without having to go via your family doctor. And of course, ophthalmology and dermatology. Now, specialist referrals to community clinics or medical centres or hospital outpatient clinics is also by the primary care physician. That's not to throw a stumbling block in your way and to make it harder. That's to enable the situation that when you come to the visit, they will have all the information that they need about you. In Israel, we're improving now the situation of communications between different organizations. For example, Hadassah communicates with our medical files and we can see things from Hadassah. But it's not 100% covering the whole of the country as of yet. So if you were to go to a doctor in a hospital without having a referral letter, he wouldn't necessarily know what medications you were taking. He wouldn't necessarily know what your blood tests were. The same thing isn't true if you go to see a specialist within your health funds, because the health funds generally have now, I think there's one exception, but the major health funds have an interactive electronic medical record. So for example, if one of my patients from Modi'in went to Eilat on holiday, they'd forgotten their medications, let's say, for their blood pressure, they would be able to go into the Maccabi clinic there and say, I have forgotten my medications. He would open their medical record, he would see what they take, and he would print it out. So it gives free access and there's good communication all around the country. Now, if you see very often people say to me, well, what's it better to do? Is it better to see a specialist in the community or is it better to go to a hospital clinic? Wherever you can, try and see someone in the community and I'll explain to you why. First of all, the doctor you see in the community is someone who has access to all of your medical records. So he can look at all of your blood tests and all of your doctor's notes on the file. Another reason is, according to the law here in Israel, the doctors who see you in the community and work in the health funds as cardiologists, endocrinologists, whatever specialty you imagine, have to be specialists. They have to be a specialist, they have to have a specialist license to practice in that field. Now, if you go to a hospital clinic, there might be 4 or 5 doctors sitting and receiving patients on the same day. One of them may be the specialist, but 4 others will be juniors who aren't yet specialists. So what it means is they won't have the benefit of the experience of that field to give you and share with you. And very often you might find yourself with someone who has less knowledge than your family doctor who actually sent you there. So as much as possible, try and see the health fund specialists that they keep and they place for you in the community. Now, if another reason to go and see the doctors the health funds employ in the community instead of in the hospital is that way there's no need for any paperwork. You have your card from whichever health fund you're a member of, they pass the card, there's no paperwork needed. If you're referred to a hospital clinic, you need something which is called a Tofes Shvaiser, you might have heard it as, or a Hitzchayvut. The word Hitzchayvut means obligation. What does it mean? It means that your health fund is giving an obligation to the hospital to pay for your services. Because basically, the minute you go and you receive services from the hospital clinic, whereas you were outsourcing your care to someone else. So it's like saying it's a blank check. It's saying, I will cover the payment that is necessary for the patient for any test you deem necessary when they're on this visit. Now that's something which you can go to the branch office and you can get in person, you can phone up or you can fax, depending on your health fund and where you are, you can be given local numbers of the branch, or you can find it on the internet. You can open up a request on the internet, pass it electronically to your health funds, and you can print out the Tofes Shvaiser at home. Now very often people ask me, well, what do we do if our doctor doesn't give us their telephone number? Not every doctor gives it. What do we do? The clinic's closed. We don't know what to do. In Israel, all around the country, there are emergency clinics. First of all, even before we've got to the emergency clinic, 2 out of the 4 health funds, Maccabi and Clalit, definitely, and Mu'chedet has a call line which I don't think is open 24 hours, but it covers most of the day, have helplines. The helplines are staffed by nurses, and there's doctors backing up the nurses. So what it means is, you ring up, you say, okay, I've got my partner at home has got chest pain. I don't know what to do. They'll ask you a history, they'll open the medical record, they'll ask you where they live, and according to what they gather from you as a history and where you are, they'll decide what to do. They might say, sit tight, we're sending you an ambulance and stay on the line with you. They might say, well, you know what, you're 5 minutes away from Terem, we want you to go to Terem. They'll tell you what to do. You don't need to start looking in a phone book or phoning friends and saying, where do I go? What do I do? One number, you should have it in your phones. Whichever health fund you're with, make sure you've got the number available to you. You turn to them, they'll tell you what to do. But for your general information, the toolkit of options that we have to offer people includes the emergency clinics that are all around the country, some of them even working 24 hours, such as the Terem Clinic. I understand that most of you are from the Jerusalem area. There's at least 2 Terem clinics that are open here 24 hours a day. There's another one in Bet Shemesh, and there's another one in Modi'in. There's also, I believe, another one in Ma'ale Adumim that's also open 24 hours. They receive all of the health funds. You go in there, out of hours, they give you a service, they'll give you a medical summary, and according to the reason you turn to them, you may or may not be exempt from payment there. Payments are exempted according to a list of criteria that are given to you. But again, if you have phoned up the 24-hour helpline and the nurse or the doctor has told you to go to the out-of-hour clinic, that might also be an exemption from the payment because they recommended you to go there. Now, another option is a home visit. It could be if you call the 24-hour helpline, they'll say, you know what, we're going to send a doctor to check you at home. It's not within 10 minutes, it's within 2 hours, but we do have that facility. An example which very commonly we might offer that solution could be someone's got back pain, and it sounds very muscular back pain. It doesn't sound like something that's sinister and needs to be in the hospital. But it sounds like from the nurse's assessment that maybe they need an injection of an anti-inflammatory, in which case we can send a doctor to check them at home. He'll assess the situation. If he thinks they just need an anti-inflammatory injection, he can give it to them there or then. If after his physical examination he feels they need further care in a hospital, of course he can refer them to a hospital, he can call an ambulance, he can do whatever he sees fit. A final resort is an emergency room in the hospital. Obviously, if you think someone is having a heart attack or has lost consciousness and you don't want to start making phone calls or anything, you go straight to a hospital. But for more minor things, it's a shame, first of all, to sit and wait half the night in the hospital, and second of all, to clog up the emergency rooms, because we all know what that's like. I'm sure you've all come from societies and cultures where, especially before the holiday season, there are adverts on the television saying, don't come to the emergency room unless you have to. You might go in there with a bruised knee, but you might come out there with pneumonia because you sat for 3 hours next to someone who was coughing and spluttering over you. The Homecare Team. Now, I'm here talking about something again which hopefully none of you will ever come to. Again, it's a service which is accessed by your primary care doctor. If I, as a primary care doctor, feel that a patient's situation has deteriorated to a point whereby they need care at home and they're not anymore mobile to come to me, then I can refer to a home care team and initiate that treatment. It could be, for example, a short-term support. It could be, for example, that someone's had a hip replacement, and for a period of a few weeks after the hip replacement, we want them to have physiotherapy at home, we want them to have a bit of occupational therapy at home, we want a nurse to go and change the wound dressing and take the staples out. That would be an example of a temporary situation where someone will be in the home care team, because once they were back on their feet and functioning, they would carry on going back to their clinic. But also there's situations where someone needs a more long-term support, where it's harder for someone to get out of the house. And again, we worry that there will be multidisciplinary care for the patient in their own home. Now, child development, looking at the audience here, I can see that there are some people that it is relevant to. So I'll explain to you a little bit about how the child development care works in Israel. Now, I spoke previously about your primary care doctor. Your primary care doctor, your pediatrician in this case, again, is the first port of call for you. Because if your child might be needing help of the child development services, there are questionnaires that need to be filled in. You can fill them in English. There's a set of 3 questionnaires, which everyone can also download by themselves on the internet. But your doctor also has them in his office and can give them to you. One questionnaire is filled out by the parents. One is filled out by the primary care doctor. And the third one is filled out by the child's kindergarten or school teacher. Because, of course, when you're assessing a child for developmental problems and developmental delays, it's very important to get a view of him from a couple of social situations and not just a situation at home. A very common situation here we see with children of people who have made Aliyah is they have something which is called elective mutism. They can be so shocked by having moved country and all of a sudden being thrown into a situation where the Gananot is speaking Hebrew all day. There might be a situation where the child has no language delays whatever at home. He speaks quite freely, but he was paralyzed by fear. And it can take a child maybe a few months until he actually opens his mouth to the ganenet, and the ganenet might think there's a much more serious problem. But when someone puts all the pieces of the puzzle together, we can accurately assess what each child needs. Now, there are... I think I jumped... Okay. Now, there are some special categories within the child development basket. There are children which are separated off who have severe developmental delays. Now, the whole field is called child development because we are generally talking about injuries or illnesses that happen during the ages of a child developing. Okay, so that's the formative years of a child is classified until the age of 9. So if a child is, say, God forbid, born with cerebral palsy or a genetic disorder such as Down syndrome, they're given an unlimited number of treatments. Again, they go to the team of people who assess a child's needs, and whatever amount of treatments the doctor says that child needs, they will get. That is given until they become aged 18 years, because we're not talking about a situation that will need to be reassessed the whole time. Obviously, they'll have follow-ups, but basically, if a child's born with Down syndrome, then that Down syndrome is going to accompany them. When they become 18 years of age, of course, they carry on getting the support, but it's in a different basket. It's no longer in the basket of pediatric treatments, as it were. Now, for those people who have a child with a developmental disability, there is no co-payment, because we know that people are going into a situation where it is long-term, lifelong, and thereby they are exempt by the law and by the basket of healthcare of having co-payments. There is also another basket which is called children with autistic spectrum disorder. That is a new definition of what was once called PDD, or pervasive developmental delay. Children who are on the autistic spectrum are given an allowance of 156 treatments a year, which is really quite a lot. That means basically if we think of 52 weeks in the year, that basically means 3 treatments a week. Of course, that could be one with a physiotherapist, one with a speech therapist, one with an occupational therapist. And that is given with a co-payment of 28 shekel. Again, there is a ceiling for that. And again, if someone has a problem with that payment, then it's not charged. I'm sorry, my phone. Must apologize. Okay, now I had another slide here that seems to have disappeared. Okay, I had another slide here on child development, but basically I will sum up what that slide said. If we're talking more about children who don't have something as radical as a severe developmental disability or an autistic disorder, the amount of treatments they're entitled to is determined by age. The younger they are, the more treatments they're entitled to. Again, that decision is made by the multidisciplinary team who assesses the child, But again, it's a very high basket. With children who are under the age of 3 or 4, they're entitled to something like 52 treatments a year. A child who's 4 to 6 is entitled to 28 treatments a year, and so on and so forth. Once a child gets to the age of 9, then from 9 to 10, treatments, again, I'm not talking about these children in the special categories, I'm talking about other children, maybe with a slight speech delay or a slight coordination issue. Once they get above the age of 9, they can use the treatments, but via the basket of additional coverage of the Muchedet C, Magen Zahav, Klalit Mushlam. And again, for a child under the age of 9, you can add on more treatments than you're entitled to, also via this basket of additional services. Making an appointment. How do I make an appointment? People very often send me emails, okay, I'm here. Now what do I do? There's a number of ways to do it. You can go online on the internet and you can make an appointment. You can phone the telephone line, which generally works 24 hours. It's the same telephone line as you would call if you had a medical problem. You listen to the operator and it says, if you want the nurse, press 1. If you want this, press 2. Now, in almost all of the health funds, you can speak to an operator in English. In Maccabi, just because I know this system, you hang on the line and they'll say, if you want to speak to someone in English, please press 4. So just have a few minutes patience and wait, because if you hang up before you've got to number 4, you don't understand that they're telling you to press 4. But they tell you in English, please press number X to speak to someone in English, and there should be an operator 24 hours who'll be able to help you in English. Another way of doing it is directly with the clinic receptionists. But now, as people are becoming more computerized, we're seeing that that's being a less popular option. People generally prefer to go online and do it, but it still exists. If someone today wants to walk into my clinic and make an appointment with me via the receptionist, they're welcome and entitled to do so. This is just a screenshot for you to see the type of internet site that we have. All of the health funds also have internet sites. Now, other services which are important for you to know about and are available on the internet are your rights and benefits. For example, there's things that you didn't remember from my presentation. There are things you're not quite sure about, and of course I haven't gone into all the fine print of every child development category and every child development issue. You can look them up online. There's things about health promotion. You've just had your 50th birthday, let's say. You want to know what you should be doing, so you're prepared psychologically when you go and see your GP. You'll then know that your GP will want you to do colorectal cancer screening, breast cancer screening. He'll want to check your blood pressure. He'll want to maybe give you a flu shot if it's that time of year, so you can actually see what's going on with your health. If you log in with your Taudat number or your personal code that you might have from the health funds, it will actually prepare you a personal healthcare record. It will tell you what you've done in the past and what you need to do. It will say, mammographia, tick, you did it last year, you don't need to do it yet. And it's quite a nice summary for you to have. There's also now, in recent years, we've added on an option. For example, if you don't need to see your doctor, it's not a medical complaint where you need him to check you, but you want to order prescriptions from him, or you were off work for one day with a stomach virus and it passed and you really didn't see it was necessary to go and see your doctor, you can open up in Maccabi a request online. It gets sent to your doctor's computer and he sends you the response back online with the attached medical permission slip or prescriptions. You can order your medications in the pharmacy, so when you get there it's to take away. You don't have to wait in the queue and be behind a row of 10 people when the pharmacist is going to the drawer and pulling out all their medications. You can send it to the pharmacy, you can tell them when you want to go and collect it, and then you go to a queue which says to take away, and you just take your medications with you. You can order travel insurance. Let's say you can do it 24 hours a day. Let's say you've got a very short notice, you're going back abroad to visit someone there and you wanted travel insurance. You can go online, you can activate it straight away. You can even do health insurance via the health funds to cover your baggage as well. Now, why do I always recommend people to do it via the health funds and not via private agencies? The reason's simple. Private insurance companies, I'm sure a lot of you in the audience will understand the private sector. They want to make profit off people. What do they want to do? They want to take our money and give us back as little as possible. That's not the situation with the healthcare funds. The healthcare funds are non-profit. Thereby, if I have a claim with a private insurance company, which wasn't connected to a health fund, they will try and find every reason in the book to say it was a pre-existing condition and I didn't declare it when I took out the insurance with them. Now, if you take out the private insurance with your health fund knows everything about you already. It's got it there. So if they're covering you, they can't come back to you and say, well, actually, X, Y, Z. What happens is when you go on the health fund site and you want to download the form or you want to purchase the travel insurance, they'll ask you a few very basic questions, such as being, have you been admitted to hospital for a surgery in the last 6 months? Have you had active treatment for a cancer in the last 6 months? A few other conditions like that. If that is the case, they won't say, no, we're not covering you, but they'll give you a higher premium to do it, because obviously the risk that they'll have to pay out while you're away is bigger. But they won't say they won't cover you, and they won't come afterwards and say, well, wait a minute, we're not paying. We don't know, you didn't declare, you weren't fair with us. Now, a lot of the health funds is a picture of the course of what I know, what's close to home. A lot of the health funds now have opened applications. It's not just a gimmick, it's not just a game like Candy Crush, it's actually something which is very, very important. It means, for example, say I was on a trip to America and God forbid I was taken ill. I can open on my iPhone, as a patient, my medical folder, which everything is written in English for the purpose of foreign and international travel, and English is really one of the universal languages, and written in there will be my active diagnoses, any medication I might take, any medication that I've had a bad reaction to in the past, my recent blood tests, my recent x-rays and a recent ECG. That information can be vital. It really can make a huge difference when you're away. Another thing which is very important, which they've provided us as physicians in health funds with, is I have an additional application as a doctor, which means if a patient of mine called me up at home, I gave them my number, I said, listen, you've done a blood test, I really want us to check up on it later. I'd be able to check up from home what the blood test result was. I'd be able to check who was on my patient list tomorrow. And again, it gives me the flexibility and the opportunity to give my patients more continuity of care. Now, I started to speak to you before about supplementary health insurance. I'm sure many of you in the room might have it. Those of you who don't, I would really recommend you have it. It's generally something which isn't very expensive. It is a very important type of insurance to have because it doesn't exclude any pre-existing conditions, in the same way that the health funds take people on as they are, whatever chronic conditions they've got. The same is true with the supplementary health insurances that the health funds offer. It is not the same if you go to Phoenix or Harrell and Menorah and you purchase additional private insurances. Those insurances will ask you to fill out a health questionnaire and will say, well, unfortunately you have a diagnosis of MS, of blood pressure, of this, of that. We won't cover anything that's connected to those conditions. Now, they are optional. I would very highly recommend them. The costs vary according to a patient age. You're not penalised because you have certain medical conditions, yes or no. It is a pure age-based scale. Coverage varies slightly between health funds. Each health fund puts their emphasis on something which they think is slightly more important to them or to their particular populations that they serve. But again, the difference is minimal. There is immediate coverage for Oleh without a waiting period if you sign up within 3 months of making Aliyah. If you don't, you might have to wait for certain treatments a certain amount of time. Now, why is that done? That's done to prevent people jumping from different health funds just to use the additional treatments that they might be allowed in this additional insurance. I'll explain why. Say someone was on Klalit and they wanted to come over to Maccabi. The time that they were in the previous health insurance would be counted, as it were, as seniority, experience, as it were, or memory of supplementary insurance. So again, you wouldn't have to have any waiting period, okay? So what it means is if I wasn't someone who'd made Aliyah, and let's say we forgot about the fact that I was entitled to joining the health funds for free. If today I didn't have any supplementary benefit and I went to my health fund and I wanted to take out supplementary benefits, they could say to me, you know what, you want IVF treatment, you have to wait 6 months. If someone comes from Clalit to Maccabi and they have had the highest level of Clalit coverage, they would be able to go straight into the highest level of Maccabi coverage. But again, because it's a universal basket, they could very well look at what you have used in the past. I didn't just pluck it out the sky, the IVF. In the past, the health funds have had a very big problem with the field of IVF. As people know, we're a Jewish population, and one of the most important values that's intrinsic to us is having children. Over previous years, we've seen this has been a huge financial problem, that people have come to Israel, they have made Aliyah for the purpose of having IVF treatment, which is free. I'm not as familiar with the situation in America. I know in England, people even take out second mortgages to actually finance IVF treatments. So they want there to be a memory that goes from one health fund to the other. For example, if the law says you're entitled to 12 cycles of treatment a year, they don't want you to then go between 2 health funds and get 24. There's a reason that you're limited to a certain number a year. It's because of the effect of the hormones on the body and things like that. So it's there to protect basically the money that we all put into the pot, that it will be used in a reasonable and wise manner. Again, the benefits and the rights that all of us are entitled to via our supplementary insurance are actually available to all of us to look into at any point in time via the brochures which are given out to people or on the internet sites. Now, we'll go through this very, very quickly. The type of care that you might be given are generally subsidized medications which aren't included in the healthcare basket. Generally, anything that I've put a star next to means pre-approval is required. For example, I need to get approval for... We're talking about things which are really, really at the far end of the spectrum, because most of the medications you need are in the healthcare basket. But let's say you needed some particular medication for ADD because the things that were in the basket, such as Ritalin and Concerta, weren't effective for you. If you wanted something specific like Adderall or something, it might be in the supplementary insurance. In that case, the referring doctor or a pediatric neurologist would have to write a letter and say, this child needs X treatment because of Y. And then it would be presented to your office and they would deal with the approval and you'd get a negative or a positive answer. Now, again, you can go and see specialists in hospitals. There is something which is called Sharap. You might have heard of it. It means Shurutim Refuim Prati'im. We're in the Jerusalem region, so I'll base it to Jerusalem. There are a list of doctors on every health fund site who you're entitled to see privately. Now, the reason I put a star here is because you don't need to get pre-approval to go and see them, but you need to check that they're on list. For example, if I don't want to wait 3 months and see any ophthalmologist or any eye doctor in Hadassah, but I want to see Professor Solomon, who might be the specialist in corneal disorders, I check on the website or I phone up my branch or go into my branch and ask them. They'll say he's there. Fine, I go and see him. In some of the hospitals, such as Hadassah, if they have an agreement with your health fund, it's deducted at source and you just pay your copay. In others, you pay, you get a receipt, you take it to your health fund, and you'll get back 85% of the cost. It's basically going to see what you would have called in the past off-list or off-health fund doctors, but your supplementary insurance is covering the majority of the costs. You could choose to have an operation, say you need an elective operation, say you needed a gallbladder out, say someone needed a knee replacement. You could go and have your surgery maybe at a private hospital such as a Suta or the Herzliya Medical Center, or you could choose your surgeon with 85% of the cost being covered by the health fund. Again, it has to be a doctor who works with the health fund, and the lists are available on the website and in the branches. I'm not going to go into IVF treatments again. There's an expanded basket of prenatal testing. There's discounts on the complementary healthcare treatments. For example, someone wants to go for tweener, reflexology, Chinese medicine, aromatherapy. Again, if you use the clinics and the healthcare, complementary healthcare networks that are associated with your healthcare funds, you will get significant discounts on them. There's discounts of various medical aids and orthotics. For example, hearing aids, which can be something which is very expensive. CPAP machines for people who have obstructive sleep apnea. There's very big subsidies with these things. For those of you who are over the age of 10, which is I think everyone in the room, and you aren't entitled to free dental care, if you go and see the dentists who are associated with your health funds, the supplementary insurance might kick in and give you free dental checkups every year, 50% on fillings and restorative treatments, 25% on orthodontic treatments. All of these things can be significant. There's also a subsidy for ambulance transportation. Now, I'll explain a couple of things about ambulance because it's something that rises from time to time. If, as I explained to you, you take the option which I always recommend and you call the 24-hour helpline and you are referred by the helpline to get an ambulance and they call the ambulance, there is no payment. There is a medical decision, you need an ambulance. If someone takes an ambulance and are admitted to hospital, there is no payment. But say, for example, someone doesn't have a car. They didn't feel well. They ordered an ambulance off their own back. They were taken off their own initiative. They were taken to the hospital and discharged. The hospital didn't think there was any need to admit them. Then you do have to pay a contribution to the ambulance fee. The reason for that is we have a limited number of ambulances in the country, and we have to encourage the population to use them in an appropriate manner. Because if, for example, someone calls an ambulance because their child fell over and has maybe broken their arm, you could be taking that ambulance away from someone a few streets away who is having a heart attack, and because of that, a further away ambulance has had to be called. But in those situations where you have to pay a contribution to the ambulance fee, and you don't fulfill the criteria that I mentioned, that a doctor ordered the ambulance, or the helpline ordered the ambulance, or you're admitted, then you get 50% of the ambulance cost paid for you here to help you out. But generally it's something that we do have to think carefully, that if it isn't an emergency, we have to be careful about how we use our resources. Now, I explained to you a little bit about the complementary medical services, that there's discounts on costs. Mu'chedet, Clalit and Maccabi all have affiliated complementary health clinics. Long-term nursing care, we also started to speak about that. Now, it's not part of the basket of services of care. It's covered by the Ministry of Health when someone gets to a point where they're not functioning at home. But there is an immediate situation. It could be that there's someone at home who has a chronic illness, who has mild dementia, and they can get themselves washed and dressed and eat and things like that, but they might walk out the door and not lock the door behind them, and it becomes very hard for their caregivers at home to carry on functioning. In that situation, of course this is an interim situation where they don't necessarily need a nursing care, but they need more support at home. In that situation, there's a few options. The health funds can activate for you and help you get your rights from Bituach Leumi, the National Insurance Agency, which sends people out to the homes and help out. It could be for 2 or 3 hours a day. It's not 24 hours a day. There is also an option of nursing care insurance. Now, the nursing care insurance with the health funds basically gives you a payout to use as you want for caring for that person at home. So it means you could choose who you wanted to bring in, not take the person who the National Insurance Institute sent to your house, but you wanted to use a special nursing team to be with the patient 9 hours at night so you could get a nice night's sleep. That would be something which you'll be entitled to if you'd taken out the nursing care with your health fund. Now, the only hitch with the nursing care insurance is you have to take that out while you don't have one of these serious conditions and illnesses that would qualify you to use it. Thereby, if people make Aliyah generally over the age of 70, their age excludes them from taking out of this nursing care insurance. But for those of you who are younger, for those of you here who have kids, listen, God forbid we all ever have to use it, but I've taken it out for my whole family. For my younger kids who are all under the age of 16, it costs me 1 or 2 shekel a month, because obviously the risk that something would happen to them and they'd need the nursing care is very, very small. You can activate, if you need, quite a few different ways to help in one go. So if, God forbid, I ever needed nursing care for someone, I could also take my rights from the National Insurance Institute, and I could also take my rights for this nursing care insurance that I had taken out. Now, the rights to healthcare coverage as new immigrants, I just want to explain it again, the main points which you can tell your friends back at home. There's no age limitation. People can come at any age. There's no health limitation, no exclusion for coverage on pre-existing illnesses. There's no waiting period. As soon as you've come, you're covered. And all your conditions and everybody who has a citizenship in Israel is covered by the National Health Insurance.